One of the hotspots includes Minnesota, where Democratic Governor Tim Walz has announced sweeping new restrictions in response to a surge in infections. The measures start on Friday and will be in place through the Thanksgiving holiday to mid-December. Under the order, residents are not allowed to gather with people outside of their own household. Indoor dining will be halted and private parties and celebrations are prohibited. Even outdoor events are being put on hold. This week, Governor Walz called the move a, quote, sacrifice that we need to make.
What even has become the new normal is no longer sustainable. The ground is literally shifting under our feet. These are, what you're looking at here, is the 7-day case growth rate, and it was about 10%. That was high but manageable. That's gone to 75%, and it will go off the top of this chart over the next 7 days.
Dan Diamond is a healthcare reporter for Politico, and he joins me now from Washington. Hi there, Dan. Thanks for being with us. The U.S. now has over 250,000 deaths from the coronavirus. It is now impacting smaller cities and towns. How are leaders responding?
Well, I think they're responding, Elaine, with measures that public health experts had wanted to see weeks or months ago, and only now are moving forward. I was in the Midwest right before the election. There were lots of local officials I spoke to, local Republican officials, who didn't want to move forward with mask mandates. They thought that they weren't necessary. Now, states like Iowa, North Dakota, they're getting much more aggressive on the steps that health experts had wanted to see weeks ago. And unfortunately, it's playing catch up. The virus has been spreading silently. And even though these measures are taking effect now, there's still going to be a period of time before they can help contain the spread of the virus.
Well, Dan, are there any encouraging signs at all where things are getting better?
Well, I think it depends on your view. In the short term, this is a tough moment for America, especially in the Midwest, where outbreaks have gotten severe in places like Minnesota, in places like North Dakota, where 1 in every 1,000 residents has now died with COVID-19, and that will probably worsen. If I'm looking for optimism, Elaine, I'm looking at the development of treatments and the vaccine candidates that have been unveiled by Pfizer and Moderna. They're very promising, but they won't be rolled out for some weeks or months to come. And by the time they get into the arms of every American, we could be looking at the second half of 2021.
Well, hospitals in several states, as you know, have begun practicing what's known as diversion. That's where incoming ambulances are diverted to other facilities due to a lack of space. So, Dan, how are hospitals better equipped to handle this recent uptick than they were at the start of the pandemic?
Elaine, I think hospitals know better what to do and also what not to do after months of fighting this virus. For instance, there is an understanding now you don't want to move too quickly to intubate patients, to put them on a ventilator, essentially, because it's harder to have them recover down the line. Instead, hospitals are more quickly moving to steroids in certain cases when the patient warrants that. There's also better arrangements around staffing and the model of the entire hospital to serve COVID-19 as necessary. But you still need people, you still need supplies to fight this uptick. And I've spoken with hospital leaders or advisors who have said, we just are hit just as the rest of the community. Mayo Clinic being an example of this. This week announced that 900 staff in the past 2 weeks have contracted COVID-19, mostly in the community. But that is a staffing crunch that hurts Mayo's ability to deliver care too.
It's really shocking to hear about that. Minnesota Governor Tim Walz has called on Congress to work to pass a relief package. Dan, has there been any engagement between the Trump administration and Congress on a stimulus bill?
Elaine, you keep asking me questions and I feel like I have to keep giving you bad news, but reality is there's very little movement on the stimulus package. The president has tweeted about the need for a big stimulus bill, but practically Democrats are still stuck on the need for, in their mind, a $2 trillion bill. Senate Republicans see $500 billion as the right level. So that's a pretty big gap. And my understanding, the understanding of my colleagues at Politico, is there's been very little movement or conversation between the Trump administration and the two sides. We may see movement in December, but the Senate has already gone on recess for the Thanksgiving break. Nothing is getting done for the near term.
So as we look at the coming months, what can you tell us, Dan, about which members of President Trump's coronavirus task force might play a role in the incoming Biden administration?
Well, the Biden team has been very frustrated and has made this known that they haven't been able to get access to various members of the Trump team. But there are some officials like Tony Fauci, who's a career civil servant, or like Deborah Birx, who is a political appointee but was held over. She was appointed by President Obama to fight HIV. She was pulled into the Trump White House as their coronavirus coordinator. She may well be someone that the Biden team wants to keep around just in order to have some transition. But as my colleague Adam Cankren reported this week, there's a lot of concern among Biden's advisors that Deborah Birx, who has been in public at times extolling the President Trump, and his attentiveness to COVID-19, statements that now seem awfully hollow. And the Biden team is really worried that she's lost credibility and not someone that they want to have as a face of their own response.
Well, Dan, we know that the data show communities of color are disproportionately impacted by the virus. President-elect Biden addressed this during a coronavirus briefing this afternoon. Let's listen to that.
The brown, black, Asian American, Native American communities are always the first ones hit the hardest and the last ones who are brought back. We're going to flip that around. It's going to be really important to determine priorities based upon access to the information that's available, access to everything.
So, Dan, this is really interesting to hear. Tell us more about what President-elect Biden's COVID-19 Advisory Board is doing to prioritize communities of color.
Well, my colleague Joanne Kennan had a great story, an interview this week with Marcella Nunez-Smith. She's a Yale researcher. She is one of 3 doctors who is co-chairing President-elect Biden's advisory group on COVID-19. Dr. Nunez-Smith has specialized in healthcare disparities, and I think the pandemic has only accelerated those disparities because communities of color often don't have access to the best care, the most physicians. And we've seen disproportionate impact of COVID-19 in these communities that were already struggling to get access to treatment well before the pandemic. So Dr. Nunez-Smith, in her role, is someone that the Biden team really hopes can figure out where those gaps are and how they can best be addressed moving forward. I would also add, Elaine, that I've talked to Biden advisors and kind of writ large, looking at the team he's putting together, they very much want that team to reflect America, they've said, to have a diverse range of opinions, of backgrounds. Dr. Nunez-Smith, as a woman of color, could bring insight, observations that a team composed largely of white men, as the Trump administration has followed, they might not see all the problems in healthcare that someone like Dr. Nunez-Smith has been trained and specialized across her career to look for.
Right, because I know in conversations that I've had with doctors and public health experts, one of the things they raise is that even just in doctors' visits themselves, there may be some systemic or structural kind of issues that aren't necessarily something that have been pushed to the forefront in the past. And at this moment in the pandemic, they think it's really critical to have that top of mind as we move forward here and try to get treatment and these vaccines out to the American people. All right, Dan Diamond for us. Dan, always great to have you reporting. Thank you very much.
Thank you, Elaine. Have a good night.